It's recording. Okay, hello. My name's Ron. I'm going to be performing a physical exam today. Could you just state your name and date of birth?
I'm aware August 1583.
Great, thank you. So we'll be doing a head-to-toe exam, starting with the head, going over eyes, ears, nose, throat, respiratory, cardiac, musculoskeletal. Do I have your permission to perform the exam?
Yes.
Great. Okay, so I'm going to just perform hand hygiene. Okay, I'm just going to start by a visual assessment. I'm going to go ahead and assess for any abnormalities off the bat, any inconsistencies. I'm going to see that the sclera are right now anecteric, so they are white. I'm going to go ahead and just gently pull down and assess the conjunctiva to see that they, yes, are pink and moist. I'm going to see if there's any abnormalities in the face, assessing both the ears, palpebral fissures, which they are symmetrical, and the nasolabial folds. So if you could, just give me a smile. I can see with a smile as well that those are symmetrical. I'm going to move on to just assess the head. So I'm going to gently feel along the scalp, feeling for any abnormalities or deformities, which there are none. Also, just while I'm here on the head, assessing the hair, which I can see there are no issues with, as well the external ears and the nose. And just noting the location of the ears, which are also symmetrical, and there are no abnormalities. Also, just going to assess the sinuses. If you could, just move your head back. Okay, I'm going to assess the frontal and the maxillary sinuses. And I'm going to move on to assess the nodes. So I'll go to behind the ears with the post-auricular nodes, feeling any for enlarged nodes or abnormalities. Moving on to the pre-auricular nodes. The occipital nodes. Noting any abnormalities or enlarged lymph nodes. The submandibular nodes. Moving on to the submental nodes, to the supraclavicular nodes, and then if you could move up a little bit there, I'm just going to go ahead and assess for the anterior and the posterior cervical nodes, which the posterior cervical nodes are rather deep. So I don't expect to feel them unless there was any abnormalities or enlargements, which there are not. They are normal. While your head is up, you just go ahead and feel range of motion of your neck, up and down, and then left to right. Okay, that is good. Then I'm also going to assess the thyroid gland. So just with your head up a little bit, just visualizing it, go ahead and swallow. Okay, great. And then just to get an idea of landmarks, I'm just going to feel along. There is the hyoid bone. Moving down. Going to feel for the isthmus, and once again, just go ahead and swallow. Okay, no abnormalities or mass noted. From the anterior approach, I'm just going to go ahead and once more assess. So I'm going to come along to each side, and I'm going to displace to the right with my left hand the thyroid and ask you to swallow once more, noting any abnormalities. And I'm going to displace with my left hand to her right, or to her left once more. Go ahead and swallow. Great. No abnormalities noted there. After the thyroid gland, we're going to assess the extraocular movements. So those are going to be our cranial nerves 3, 4, and 6, as well as visual fields and pupillary reaction. So for extraocular movements, I'm just going to form an H pattern with my finger. If you could, just follow along with your eyes. And the EOMs 2, 3, 4, and 6 are intact. I'm going to go ahead and assess pupillary reaction with the ophthalmoscope. Okay, so I'm just gonna, first I can start off for assessing a consensual response. I'll bring my finger in and just watch for the constriction of the pupils as I move inward, okay, which I can assess is positive. And then I'm gonna do the red light reflex. Just gonna shine a bright light. You can look straight ahead, okay, at both eyes, and see that there is an equal red light reflex in both eyes. And there's no abnormality noted. And then as far as to perform an exam of the fundus, I'm going to come in from the patient's side. You can look straight ahead at about 15 to 20 degrees to the side. I'm going to ask you to cover your right eye, okay? And I'm also going to cover that same side eye, and I'm going to come in very closely. Okay, assessing the fundus. I'm going to do the same from the opposite side. Closely assessing the fundus as well, while magnifying with the up-down scope. Additionally, just to assess for light accommodation on both eyes, I'm going to go ahead and place my hand midline here and assess the opposite eye that the light is not being reflected in for a constriction. So I'm going to shine a bright light, okay, which that is positive. There is constriction on the opposite side, and the same with the left eye. Okay, equal constriction with both eyes. Okay, moving on, after that, we're going to just inspect the ears. So with the otoscope, I'm going to go ahead and assess the tympanic membranes, but first going to assess to see if there's any discomfort or pain beforehand. Going to gently pull on the tragus, pull forward and down. Is there any discomfort with that?
No.
Okay, great. So I think I'm going to go ahead and pull upward and back, and gently insert the otoscope about a 1/2 inch and assess. Which this looks great. There is a pearly gray tympanic membrane. Moving on to the opposite side. Same assessment for any discomfort. Pull down the tragus, move forward, then down. Is there any discomfort with that?
No.
Okay, great. So I'm going to go ahead and assess this as well. I'm going to pull up and back. Gently insert about a 1/2 inch. And I can visualize the tympanic membrane, which is pearly gray as well. Both normal. Moving on, the whisper test. So I'm going to have you cover your right ear. I'm just going to whisper, and I'd like you to tell me what the word is.
99.
Okay, I'm going to move to the opposite side. Do the same, covering that ear. What number?
89.
Okay, great. And then after the whisper test, we're going to do the Weber and the Renee test. So with the bone conduction versus air conduction, I'm going to gently tap this device and we'll place it on bone first, and you should feel the vibration when it stops vibrating and you can no longer feel it. I'm going to move it after you tell me so, and to the front of the ear. You'll continue to hear it ring. Let me know when that stops.
Stop. It stopped.
Okay, so that was a normal response. I'm going to move on to the opposite side. I'm going to gently place it on the mastoid bone. Tell me when it stops.
It stopped. It stopped.
Okay, great. So that was a normal response, as the air conduction is always greater than bone conduction with normal hearing. So I'm going to move on to assess with the same device, placing it on the forehead. Just let me know to which side this noise or vibration is lateralized to, one or the other, or both.
It stopped, and both ears.
Both ears, okay, which is a normal response. If there was any abnormality, it would lateralize to the affected side, which it did not. Okay, next I'm just going to examine the oral mucosa. I just have you open your mouth. I'm going to assess the tongue, teeth, which is pink and moist, okay, as well as the uvula. And if you could just say ah, okay, which that is moving symmetrically. There is no mass. There's no abnormalities noted. And then movement of the tongue as well. If you could just stick out your tongue, wave side to side, left to right. Okay, and then on the inside of the mouth, push against your cheek, both sides, great. And that is just the assessment of the glossal pharyngeal nerves. So I would, in a awake patient, just describe how to perform like the gag reflex, which we're not going to, but I would simply have a tongue depressor that I would displace the tongue with, and then with a second tongue depressor, press onto the inside of the oral pharynx and elicit a gag reflex. Or if you like, you could just go ahead and perform like a hard swallow as well, and the gag reflex is likely intact. Phonation, one more, we already did that. Let's see, masseter muscles, so your muscles of mastication. I could, with a tongue depressor, have you bite down and just assess by trying to pull on it your strength of the muscles of mastication, but I'm going to just have you gently go ahead and bite down and feel both sides, relax again, and once more, bite down. Okay, great, and I can feel they're equal on both sides. And as far as your sensory nerves of the trigeminal nerve, we're going to go ahead and just assess the forehead, cheek, and chin. So I just want you to tell me if you have normal sensation as you feel my fingers brush across. Can you feel them?
Yes. Yes. Yes.
Same for the opposite side.
Yes. Yes. Yes.
Okay, so that is normal for the trigeminal nerve for the sensory branches of the forehead, cheek, and chin. Next, moving on to just assess the spinal accessory nerve. I'm going to have you shrug your shoulders against my hands. Go ahead, and they are equal on both sides. And as well, I'm going to place a hand on each cheek. Just go ahead and press into it, and I'm going to assess your strength with that as well. That's good. That's good. And that is the same, so they are equal on both sides. So cranial nerve 11, the spinal accessory nerve is intact. And then lastly, we're going to do an acuity test with the Snellen chart. So if I could, I'm just going to place this about 14 inches from you, ask you to just, well, do you wear any glasses?
No.
Okay, so if you did, we would have you perform the exam with the glasses, but since you don't, you can cover one eye. We can start with the right, and with the Snellen chart about 14 inches away, go ahead and just read.
ETLNPDCFTCLOPDENTFOLCZ.
Great, and with the opposite eye.
ETLNPDCFTCLOPDENTFLCZ.
Great. Okay, so that was a normal exam with the Snellen chart. And then lastly, I'm just going to move on and circle back around to the olfactory nerve, cranial nerve 1. This is a tincture of an extract, either vanilla, coconut. Just tell me which you smell.
Yes.
Which flavor?
Vanilla.
Very good. Okay, and that completes the first exam of head, eyes, and ears, nose, and throat. So next we're going to begin with the chest and respiratory assessment, looking at the anterior and the posterior thorax. I'm going to start just by assessing the anterior posterior dimensions, noting the proportionality. They are at a 1:2 proportion, which is within normal limits for a normal exam of the chest. As well as for the precordium, I'm not noting any abnormalities, just off of my visual assessment. Going to move on to listening for any carotid bruits, so you could just sit, and with the bell portion of my stethoscope, I'm going to listen for any bruits at the point where the carotid bifurcates. No bruits are heard. Moving on to the opposite side. Likewise, no bruise are heard there either. Okay, next I'm just going to go ahead and palpate the anterior chest. I'm going to feel for any thrills or any heaves or any lifts at any point in the precordium area. Okay, which there were no heaves felt or thrills or any lifts noted on exam. So moving on, I'm going to go ahead and assess the apical impulse. This is going to be at the fifth intercostal space, mid-clavicular line. I'm at the fifth intercostal space, mid-clavicular line, left sternal border, and assessing a normal apical pulse. Okay, as well as far as any right ventricular heaves, I'm going to go ahead and assess at the left sternal border for any right ventricular heaves. Okay, none are assessed. Next, I'm going to go ahead and percuss the lung fields bilaterally, including the apices. So starting with the apices. There are no abnormalities, normal resonances heard throughout. I'm going to go ahead and auscultate the anterior lung fields. You'll be using the diaphragm portion of the stethoscope. You just gently take a deep breath in and out as normal. And assess the apices. No abnormalities noted, clear throughout. Next, I'm going to go ahead and auscultate the valves. We're going to go through the aortic, pulmonic, tricuspid, and the mitral valves. And normal S1 and S2 are heard throughout, both for S1 for the mitral and tricuspid valves, and S2 for the aortic and pulmonic valves were heard. Next, we're going to go ahead and use the diaphragm and have you lean a little bit forward and listen to the apex on the left sternal border. okay, which is heard without any abnormality. I'm going to also now assess for any chest asymmetry or abnormalities with the respiratory pattern. Moving on to the posterior, so you can just take a deep breath in and out. Okay, none are noted. And if you could just turn sideways, I'm going to go ahead and just assess likewise for any abnormalities or any asymmetry. You go to the costal angle here and have you take a deep breath in. Okay, and both hands are moving symmetrically with that respiratory movement. As well, while we're on the posterior portion of the back, we're going to go ahead and assess for any spinal abnormalities. So I'm going to go along the spine and paraspinal muscles and assess for that at this time. And let me know if there's any pain, tenderness, or discomfort.
Okay.
Which through the spinal column and paraspinal muscles there are no abnormalities, tenderness, or discomfort felt. I'm going to go ahead and percuss the lung fields on both sides, starting with the apices. Again, looking for any dullness or any indication of opacities or consolidation in either lungs. Which one was heard? I'm going to go ahead and auscultate as well, both sides. Just normally take a deep breath in and out, starting with the apices. Okay, and both sides were clear to auscultation bilaterally. From this point, we're going to do some breath sounds. We're going to do egophony, bronchophony, and whispered pectoriloquy. So we're going to start with the whispered pectoriloquy. I'm just going to go ahead and listen as I move my diaphragm from field to field, just whisper very gently and softly, 99. And I'm going to be listening throughout to see if there's any abnormality noted. It should gradually become more muffled and indistinct, noting normality, and if there's any increased resonance of the whispers, or if the whisper stays the same throughout and does not change and is at the same tone throughout, that indicates some consolidative process or underlying infectious process. So just very lightly, 99, whispered.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, great, thank you. And once again, as we went from the upper portion to the lower apices or to the lower lobes, the sound did trail off and become more indistinct and muffled as we went. Additionally, we're going to do egophony, so I'm going to have you, as I move the stethoscope across each lung field, just say the word or the syllable E aloud as I move from space to space.
E, 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 E.
Okay, great. And that as well was normal. It was the same throughout. There was no change in what was heard. It sounded like E throughout and did not transmit through the stethoscope into an A phonation, which would be indicative of a consolidated process or other underlying tissue issue. Lastly, we'll do bronchophony, and I'm just going to have you say the word out loud, 99, no whispering, just as I go through each lung field.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, great. And again, once more, that was equal throughout. There was, or not equal throughout, it was heard, and as it traveled from the upper lobes to the lower lobes, became less distinct and was more muffled, so indicating that as a normal exam, and there's no concern for any consolidative process or any underlying tissue abnormalities. Lastly, from the posterior, for inspection or assessment for any costovertebral angle tenderness, the CVA tenderness that would be felt with a underlying kidney issue or an infection, we're going to go ahead and test for that. So I'm gently going to place my hand on that portion back there and strike it with my opposite hand with a fist, just gently. And if there's any tenderness or discomfort, I would like you to let me know.
Okay.
We'll do both sides. Okay, and this is just to assess for CVA tenderness. Okay. Any pain or discomfort?
No.
Any pain or discomfort?
No.
Okay, so bilaterally there was no CVA tenderness assessed, which indicates a normal exam. Okay, and that about wraps up this portion where I'm assessing the anterior and posterior thorax in a sitting position. The last thing I have to do would be just to have you position yourself in a left lying, left lateral recumbent position. And I'm just going to go ahead and make a quick assessment, and also we'll take heart sounds. Okay, thank you very much. And I'm just going to listen for with the bell portion of the stethoscope, the apical pulse in this position. Okay, well done. And normal heart sounds S1 and S2 were accentuated a little bit in that position. Thank you.
You're welcome.
Okay, so moving on to the next part of the exam, we're going to do extremities, breasts, and abdomen exam. So starting with that, I'm just going to have a visual inspection first, looking for asymmetry of the breast, which there are none noted. In this sitting position, you can put your hands on your hips. Okay, likewise looking for any asymmetry on either side, where that would indicate if there was any tumor or mass pulling on the breast muscle tissue, there would be an abnormality or asymmetry would be noted, which there's not. So you can also put your hands to your side and then raise them both in the air. Okay, again, looking at both the left and the right sides, just visually inspecting. I don't see asymmetry noted, which is normal, so you can rest your hands back down on your sides. While you're in the sitting position, we'll run through a couple of the pulse checks. So I'm just going to go and assess your radial and your ulnar arteries of your hands. So I'll take the left hand. Just going to go ahead and assess the radial artery, which is present, and I'll take the right. And just feel for both arteries in that they are within normal limits and present. They're neither diminished nor bounding, they are normal pulses. And then going into the ulnar, I'm going to assess the ulnar artery and the ulnar pulses. Great, in which both are also present and within normal limits. On next to the Allen's test, so we're going to take both the radial and the ulnar artery and just compress them, which we will see a discoloration where the capillary refill will decrease when those arteries are compressed in the palm for a period of about 15 to maybe 20 or 30 seconds, and then releasing on either one of the arteries, watching for capillary refill, which would be a normal Allen's test, indicating that there's no occlusion or any abnormalities present. Okay, so both arteries are compressed. Obvious color changes noted within the palm. Okay, I'm just going to go ahead and release the radial artery, in which capillary refill immediately occurred, and indicating a normal exam. And likewise, I could do the same with the ulnar artery. Okay, and good capillary refill is present with the release of the ulnar artery. Moving on to the right hand, same thing. I'm going to compress both the radial and the ulnar arteries. Okay, waiting for color change from pink to a little bit more pale. All right, so after about 10 or 15 seconds, we've achieved that. I'm going to go ahead and release. Okay, and immediate capillary refill from the release of the right radial. Okay, once more, we'll just test the right ulnar. Okay, and with release of the ulnar, immediate capillary refill of the palm. So, indicating that is a normal Allen's test, good capillary refill with the release of either artery on both hands. Other pulses we're going to go through, just check the brachial pulse. So the left brachial. And the right. Okay, and they are both present laterally, and both brachial pulses are within normal limits. As well, we can assess for any upper extremity edema. You can relax his hand. I'm just going to take note of any trace edema present throughout the upper extremity into the lower extremity, which there is none. Normal skin tone, normal capillary refill, no edema. You can relax that hand. And the same with the opposite side. No edema noted in the upper or extremity or lower extremity or hands. And again, that's also within normal limits. So from there, we're going to go ahead and do a breast exam and then the abdominal assessment, so you can lay back. All right, and then for the breast exam, we're going to go ahead and just, for the left arm first, the left breast, just raise that above your head, and just relax it. Okay, and I'm going to go ahead and work from a normal, in a normal fashion from left to right, through the breast tissue here and assess for any abnormalities, masses, or nodes. And as we reach the bottom portion of the breast, on the left side, there are no abnormalities assessed, and this is within normal limits. Okay, you can relax that hand, and we can do the same with the right, just raising it above your arm and relax, above your head. You're going to work in a similar fashion. Okay, working from the tail of Spence, all the way down to the lower portion of the breast, in a left to right fashion. Again, noting that there's no nodes, masses assessed, and this is within normal limits. Typically, most abnormalities will occur within the tail of Spence. And as we've reached the bottom of the breast on the right side, no abnormalities were noted. Okay, moving on, we're going to do the abdominal exam. So just to do a visual inspection off the bat, I'm going to have you just raise up so I can inspect the abdomen. And looking at first, I want to see that there are no scars or obvious deformities or malformations. I'm also going to assess for any obvious pulsations, typically anything within the area of the aorta, or there could be any other arterial or arteriovenous malformation causing a pulsation, which I do not see any bounding. Okay. mind except for your very minimal amount of the ascending aortic vessel with some very minimal pulsation. So after seeing that there's no abnormalities or scarring of any kind on the abdomen, we're going to go ahead and listen first before we palpate. So I'm going to run through each of the fields, just moving in a circular formation, starting in the right lower quadrant. Okay, which vowel sounds are present? So we're going to move up through the right into the right upper, and the epigastric, the left upper quadrant, left lower quadrant, to the hypogastric, in which vowel sounds were present throughout. If there were not in any one area, we would wait anywhere from 5 to 20 minutes and auscultate for vowel sounds before saying that there were none heard. After auscultating, we can go ahead and gently palpate each of the regions. We'll do gentle pressure at first. If there's any discomfort or tenderness, just let me know. Doing okay? Any discomfort or tenderness?
No.
Okay. All right. And that was just with gentle palpation. I'm just going to press a little bit more firm. Does any of that change? Is there any pain or discomfort throughout?
No.
Okay, great. So at this time, the abdomen inspection and palpation is within normal limits. We're going to go ahead and identify the liver and the spleen. So with that, just going to go ahead and palpate and percuss, rather. I'm going to listen for increased dullness as I palpate upward toward the liver. Okay, and as we get up toward the epigastric area in the midclavicular line, a dullness will be noted. And I place that right about here. Okay, and then just notating that, I'm going to move up from the right lower lobe of the lung and percuss. Okay, again, going from an area where the percussion with resonance of the lung changes to dullness. Okay, we've identified that. And then measuring that. That places the liver at about 6.5 centimeters. Okay, and then in assessment of the spleen, I'm just going to have you gently kind of rotate toward the window. Okay, you can come back a little bit more. Okay, that's perfect. And then around the 9th, 10th, and 11th, the ribs, I'm going to percuss and listen for the same sound of dullness to where we would assess the spleen to be. Okay, and I've picked up the dullness to be present right in this area of about the 10th, 11th rib. Which only percussing is allowing us to identify its presence. It's neither enlarged and is within normal limits. I'm going to move this pillow out of the way, and we're just going to quickly assess the aorta. I'll need to just visualize that once more. So just to get an idea of the measurement, and watching for the pulsations of the aorta, and then feeling going to look for the border on the left and on the right side of the abdominal aorta. which should only be about 2 to 3 centimeters, and we're at right about 2 centimeters at this point here. I'm also going to use this opportunity just to auscultate for any bruits heard along the aorta and both the renal arterial offshoots and the iliac arteries. And there are no bruits heard throughout the iliac or the renal arteries. So that concludes pretty much the abdominal exam. There's nothing else that was assessed that was abnormal or any. All right, and then after we've gone and assessed the radial and the brachial pulses, I'm going to go ahead and do the epitrochlear nodes now at this time. So we'll start with the left arm. If you could just raise it up. Okay, not assessing anything abnormal, just looking for any enlarged abnormal lymph node, which there are none. Same with the right arm. And the epitrochlear nodes are within normal limits, mobile. There are no fixed, hard, tender. Is anything tender or uncomfortable? No. Okay, so the epitrochlear nodes are also within normal limits. Okay. Lastly, with the musculoskeletal, we're going to perform a lower extremity assessment and then gait, range of motion, and reflexes. So for the lower extremities, I'm just going to perform a visual inspection, looking for any obvious things that are present, scarring, varicose veins, any skin issues, lesions, rashes, etc. None are assessed. No obvious deformity of any of the bones or the joints of the hips, knees, or the feet and ankles. And I'm going to palpate for pulses initially. So the right dorsalis pedal pulse is normal, within normal limits, and the right posterior tibial pulse additionally is present within normal limits. The left posterior tibial is present within normal limits, and then the left dorsalis pedal pulse also normal. And then we're going to go ahead and palpate them at the same time. Okay, and they are both present and equal bilaterally. And the posterior tibial pulses likewise at the same time. And they too are equal bilaterally. Moving up, I'm going to go to the popliteal pulse on the left arm, left leg. Okay, which is present and within normal limits. And then also on the right leg. Okay, which that too is present, and we can also at the same time assess both popliteal pulses simultaneously. Okay, which they are, equal bilaterally. Moving up to the femoral pulse on the left. which is normally present on the left, and then again to the right. Which is also present, and then we'll simultaneously palpate both femoral pulses, which they are both equal bilaterally. Moving on from those pulses, we'll check the inguinal lymph nodes. Assessing for any abnormalities, any enlarged lymph nodes. Is there any pain or tenderness with this?
No.
Okay, so no abnormalities noted as we palpate through the inguinal lymph node area. Okay, so that concludes the lower extremities. From here, I'll have you sit up and we'll do a brief gait test. So I could have you stand from this wall and just observe. If you could, just very easily, just walk straight forward to me, turn around and go back. Okay, great. Any imbalance or any abnormalities noted right now? Okay, great. So we'll start by just performing the heel to toe test. So just once more, just walk straight to me. Okay, and that is noted to be normal, no abnormality or asymmetry, no loss of balance. And then if you'd like to turn around, we'll do the same thing except with walking on your toes only. Again, noted to be equal on both sides, symmetrical with no loss of balance. And then we'll have you do just a very shallow shallow knee bend. All right, a couple more times. No loss of balance. Patient's able to perform that with no problem. Also perform the Romberg test. You can come up a little bit more. Right here where you're standing, I'm just going to go ahead and have you close your eyes. All right, you're going to raise your arms out in front of you. I'm going to have my arms to either side. Okay, so I'm just going to have you maintain this position for about 30 seconds. If you have any imbalance, I have a hand on either side of you, so as to be sure you won't fall, which would be positive for an abnormal Romberg test. If there was loss of balance, a little bit of wavering is okay and normal. Okay, so otherwise this appears to be normal. It's been about 30 seconds with the patient's eyes closed, arms raised. There is no pronate or drift of either arm present with this Romberg test. No loss of balance, indicating that it is a normal Romberg test. You can relax. And we're going to go ahead and perhaps we're going to do a couple of deep tendon reflex tests. So we'll bring this chair over. Have a seat. We're going to go ahead and do some of the deep tendon reflex tests. It will be the quadricep, the Achilles, the brachioradialis, tricep, and the bicep tendon reflexes, as well as maybe in a lying position, the Babinski reflex as well. All right, so starting with the quadricep, I'm just going to have you dangle your legs quite loosely. And although I don't have the queen square hammer, we're just going to use a regular tendon reflex tool. All right, so we're just going to go ahead and elicit the quadricep response bilaterally. Okay, and on to the Achilles heel. Just going to put a little bit of gentle pressure and tap the Achilles. Okay, and moving on to the bicep reflex. And strike the hammer on my thumb and just elicit that. Okay. So moving forward, we're going to go ahead and walk heel to toe. Once more, just assessing for any loss of balance or abnormality inconsistencies, which there are none. And then returning back to the wall, we are going to do walking on our toes. And then returning back, we're going to be walking on our heels, which there is no abnormality or loss of balance. And then you could turn around and just normal gait, go back about halfway, and then turn around for the camera. And we'll just do some shallow knee bends from this point. Okay, again, normal, no loss of balance, no abnormality noted, and then also hopping in place. Okay, and that was good with no loss of balance, no abnormalities noted. Here I'm just going to visually assess for any obvious joint deformity while you're in the sitting position in front of me. Looking at the lower extremities, there's no joint deformities in either the foot, ankle, knees, moving onward to the hips bilaterally, as well as the wrists, the elbows, the shoulders. No obvious joint deformity is present. As far as edema, we've done the lower extremity exam for edema, which there was none present, and as well for the upper extremities, there is no trunk edema. Moving on to range of motion, we can start with the lower legs. I'll have you just, with normal strength, go ahead and just push your foot up into the air. Yep, and then try to resist my hand. Great. So that strength is about normal. It's +5 for normal strength, and then pull down against my hand. Okay, additionally, that is normal strength, so I would grade that 5 out of 5. And then on to the right. Okay, this again is normal strength, and pushing down. Okay, that is also normal strength, so 5 out of 5 on the bilateral legs. And then as far as the plantar reflex, I'm going to have you just push down as hard as you can, and that is normal strength, 5 out of 5. And then retract back in a dorsal fashion, so the dorsal motion is also a 5 out of 5. And the same with the right leg, push down with the plantar reflex. That's 5 out of 5, and then dorsal is also 5 out of 5. So the dorsiplantar strength is 5 out of 5. The same with the bilateral legs. Moving on to the upper extremities. You can put your hands out in front of you in this fashion. Hands up, and I'd just like you to pull me into you. Okay, and that's 5 out of 5 strength. And then palms out toward me, push me away. Equally, this is also normal strength, 5 out of 5. So no inconsistencies, no abnormality noted in strength. Bilaterally in either arms or legs. And then as far as the joints, no abnormalities noted in the joints. We could perform a range of motion exam. If you could, just for your upper extremities, go ahead and raise them above your head. Okay, and then down. Okay, and then just flex in and out. Okay, no range of motion issues with the upper extremities. And the lower extremities were already tested, so none there either. Next, we will move into the spinal exam. So at this point, we'll stand up. Remove the chair. Right, I'm going to have you turn around and face the wall. I'm just going to visually inspect for any obvious abnormalities noted of the spine, of which I can see there are none. Next, a off the bat inspection for any deformities such as scoliosis or kyphoidosis, specifically for scoliosis exam. I could have the patient just gently bend over at the hip, and just assess the spine, seeing that it is straight throughout, there is no S-curve, there's no deformity noted, so that is a normal spinal exam. Okay, you can stand up straight. Okay, so moving from the biceps reflex to the tricep reflex, I'm going to go ahead and dangle the upper arm, just let that hang loosely. I'm going to look for the tricep deep tendon. Okay. Yeah, let that dangle loosely. Okay. And to wrap up, I'm going to do the Babinski test. I'll just need you laying in a position where I can have your foot extended. Yep. And then I'm going to gently just go along the sole of the foot to elicit the Babinski reflex response. Reflex going up the sole. Okay, the same on the opposite side. Okay. All right, and then lastly, we can have you stand, and we're going to just perform the assessment of the spine. So I'll have you turn toward the wall. Just going to assess the spine once more. Okay, we've already looked for any deformity with the spinal assessment. By bending over, there was no malformation or S-shaped or any pattern noted. There's no kyphosis, no lordosis. However, we're just going to do the range of motion testing for the spine. So I'll just have you lean forward and then backwards. Great. Okay, and then left to right from the hip, assessing the spine if there's any difficulty or abnormalities noted with that, which there were not. Okay. Okay, and to just continue on with the musculoskeletal and the sensory component of the exam, we're going to do a few tests. We're going to do the stereognosis, graphiesthesia, and two-point proprioception. So I will have you just follow my finger. You're going to go ahead and point to my point with your finger. Okay, great. Same hand this one. Great. 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 Okay, so that is complete. And as far as the graphiesthesia, I'm going to go ahead and have you close your eyes. And with an instrument, I'm going to go ahead and create a pattern on the palm of your hand of a number. Just tell me what the number is.
3.
Great.
12. 11. 0.
Great. Okay. And we'll do the other hand as well.
1. 0. 3.
Great. Well done. And then for the two-point proprioception, I'm going to have you close your eyes. And I'm just going to ask you if the contact that I make with these two pens is either with 1 point or with 2. The caps are off. I'm not going to draw on you. All right, 1 point or 2.
1. 1. 2. 2. 2. 1. 1. 2.
Okay, and on to the other hand. Same thing.
1. 2. 2. 1. 1. 2.
Great. And then for the stereognosis, I'll have you close your eyes, and I'm going to place a few things in your hand. I would just like you to tell me what those things are. Okay, you can put your palm out. First one.
Pen.
Great. Second one.
Syringe.
Great. And the last one.
Tape.
Very good. Okay, that is all. Okay, and lastly, I'm just going to perform a couple of sensory functions or assessments of light, touch, sense, pain, and perception. So you can close your eyes once again and just let me know what the sensation is, if it's light touch, if it's pain, if it's vibration.
Pain.
Okay.
Light touch.
Okay.
Vibration.
Very good. Okay, so to continue on with the sensory portion of the musculoskeletal exam, I'm just going to go through a few things just to assess your sensory function of pain, sense of pain, light touch, vibration, and sense of position. So with that, we can start off. I'm just going to have you close your eyes. And I want you to tell me if, as I go through the motions, if it's light touch, pain, or vibration.
Light touch. Vibration. Light touch. Pain.
And then with positioning, I'm just going to have you keep your eyes closed. Now put your hand in the air. And I just want you to tell me in which direction is the finger facing you, tied toward me or toward yourself?
towards me, towards you,
Okay, you're going to bring your hand up. And once more, toward me or toward you.
towards you, towards you, towards me, towards me, towards you.
Okay, great. Very good. That's all. Thank you. Okay, Anna, I want to say thank you very much for participating in today's physical exam. It's very much appreciated. And overall, in conclusion, to review, the physical exam was more or less benign. From a neurological standpoint, I found no abnormalities or deficits noted in any of the cranial nerves assessed, neurologically intact with no deficits. From a head, eyes, ears, nose, throat, with respect to that, the exam was also within normal limits. Head was without any abnormalities. Ears and nose within normal limits. Structures were symmetrical. Eyes were anecteric with a normal sclera. A normal visual assessment via the Snellen's eye chart. The ears were also within normal limits with a visible pearly gray tympanic membrane bilaterally with no discomfort or no discharge noted. And then as well, the nose and throat exam was also benign, as well as the oral pharynx. From a cardiac standpoint, I auscultated heart sounds. There was a normal S1 and S2. I could not appreciate any other extra heart sounds. No murmurs, no bruits, no S3 or S4 appreciated. And then peripheral pulses were present throughout. And were also within normal limits and normal pulses, neither diminished or full. From a respiratory standpoint, lungs were clear bilaterally. I could appreciate no extra breath sounds. There were no wheezing, no obvious bronchi, crackles, no other breath sounds, no stridor. And then a respiratory rate was within normal limits as well, was regular and unlabored. From a gastrointestinal standpoint, the abdomen was assessed and was soft, non-tender. Bowel sounds were heard throughout. Palpated the liver which was within normal limits, and we were able to percuss the area around the spleen. And there were no deficits noted of the GI exam. From a musculoskeletal standpoint, that as well was normal with no deficits. The spine and musculoskeletal joints and deep tendon reflex exam was also benign with no abnormalities assessed. Normal gait, normal Romberg test results. There were no deficits noted on exam of gait and stride, and as well as no deformities noted on assessment of the spine. And as far as the integumentary exam, there were no obvious lesions assessed. There was no rashes, scars, or any other obvious lesion present on physical exam. So that more or less concludes the physical exam performed today.